My name is John Mesa. I'm the Director of IT Infrastructure at Baptist Healthcare. They're a community-owned, not-for-profit out of Pensacola, Florida. I lead the systems teams and the network teams in supporting the server infrastructure, storage, connectivity for the hospital enterprise system. Something that a lot of folks don't think about in terms of connectivity at the hospital is how devices talk to other devices. Part of my team's responsibility is securing those connections. Once we get that set up, then connectivity is good for patient care. Security is our number one there in terms of connectivity. Top priority for my team this year is education and training. We want to make sure that they're current with their IT knowledge and they're able to apply that towards what we're working on at the hospital. Infrastructure, hardware, those are pieces that we can upgrade rather easily. The human capital is what we want to make an investment in. IT investments in my role should be looked at as investments in patient care. We have infrastructure that at the end of the day supports how the doctor's providing their care. So recently we onboarded several Da Vinci robots for patient care. Those require network connectivity, so we had to make sure that our networking gear was updated and able to support that connectivity. We use investments in hardware as an investment in patient care. Connected care in our day-to-day operations for me means the IT path from, say, my infrastructure through a server that's hosting an application for a doctor and how that provider will access the application to provide patient care. For instance, we have our central monitoring unit. They have patient metrics that show on their displays that are offered up by equipment in our data centers. From the infrastructure layer all the way through to patient care, there's connected technologies. One signal I'm watching that might provide an impact to infrastructure in our teams is the rising occurrence of cybersecurity incidents. We want to make sure that we're training our folks on being able to recognize social engineering attacks, phishing attacks to keep our network safe and ultimately our patients safe. We're looking forward to using AI to remove some of the more mundane tasks that the staff are performing and free them up to do more high-value jobs, ultimately for our patient care. AI and infrastructure is helpful in the security side. We got to make sure that governance is in there and that AI is providing the value that we want and also making sure that our data security needs are met.